Good morning. My name is Alexis Ford, and I am the Director of the Federal Emergency Management Agency. The information I am about to discuss is regarding the influenza vaccine. On December 15th, it was discovered that an influenza vaccine dispersed in September was contaminated. This was discovered after several cases were reported to the CDC. The CDC has traced the initial cause of these symptoms back to the influenza vaccine. Currently, the CDC is working to determine the exact cause of the contamination and ruling out any bioterrorism threats. There is not an effective treatment at this time, but the CDC will have an update on the status of an antidote on December 16th. The vaccine was distributed in December to 21 different states. The states are Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. Out of the 21 states that have received the vaccine, 9 of those states have reported cases. Those states are Maine, New Hampshire, Ohio, Kansas, Minnesota, North Dakota, South Dakota, Indiana, and Iowa. There's not a way to identify specific individuals who received the contaminated dose. Not all of the doses were contaminated. The vaccine mutates into a deadly injection within 30 days of injection. Within 3 to 5 days of initial symptoms, the vaccine will attack the nervous system. After 3 to 5 days of symptoms, a person can expect paralysis and/or death. Currently, there has been over 256,000 cases of paralysis and about 54,000 cases of death. All hospitals in the United States have been alerted to maintain space for admissions and create a triage area. All states that have reported cases have been alerted to activate the National Guard to help the triage process. All healthcare facilities have been asked to identify patients who could be affected. All healthcare facilities are required to notify any patients who could have received a dose and report any positive cases to the CDC immediately. All facilities, including pharmacies, are to report the data to which patients receive doses to the CDC. All healthcare providers will discontinue their influenza vaccines until further notice. The Federal Emergency Management Agency and the CDC ask the public to discontinue seeking influenza vaccines until further notice and report any healthcare facilities that are not in compliance to their local police departments. The CDC has created a checklist for the public to follow and a website with all up-to-date recommendations, a tracker to determine the closest triage section to you, and a report function to submit concerns and violations to the CDC. To minimize the amount of traffic and prevent hospital overflow, the public is encouraged to use the National Nurses Hotline to determine if they need to report to the emergency room for any reason. Each state has created a hotline, and the phone numbers for each state's hotline is listed on the CDC website, which is www.influenzavaccine.gov. If someone you know or you are experiencing any of the following symptoms, please reach out to the nearest triage center immediately: vomiting, diarrhea, fever, headache, and paralysis. Some people may be experiencing symptoms and may not have the ability to reach out for help. Please reach out and check in on your family, friends, and neighbors. The best way to mitigate through this disaster is to work with one another and look out for our communities. Again, the CDC is working incredibly hard to look for different solutions. The help and compliance from the public will help tremendously in figuring out the solution for the disaster. While this may feel scary, the most helpful thing to do is remain calm and stand strong as a community. Thank you.